Thank you, Lisa, for the introduction. So I want to mention another, if you have Alzheimer or Parkinson, if the doctor diagnose you have those disease, those illness, you automatically qualify for long-term care, even without this. Okay, because if you don't, you cannot remember to do anything. So I think the memory is a big deal when it comes to long-term care. Because when you lost your memory, you cannot live by yourself. You cannot be somewhere all by yourself. You have to be monitored 24/7. Make sense? Yes. So Susan, do you have your name Susan, right? Do you have any family member, anybody you know actually need long-term care or check into the nursing home?
It's my sister and mom, my brother sitting there, but she's in North Carolina, so I would
Mm-hmm.
be able to do anything. They kind of find a place in the island.
Yes,
She has MS.
I see.
She's terrible right now.
Mm-hmm. Also, your brother taking care of her, not admitted to any facility yet.
No.
Okay. Yeah, that's a lot of like burden on the family member. It's not easy.
My brother is sick, so.
Oh, okay.
Yeah.
I see. So if a spouse or significant one, also not feeling well, like your brother, or if I have a full-time job, I need to support my family. I have to take care of my loved one, but then I also have to go work. There's a conflict there. There's a huge burden. When a family member needs long-term care, all retired. Okay, so they have steady income then. Okay, that's good. All right. So let's talk about the chance of having anybody needing long-term care, right? So what is chance? We everybody buy insurance for our house, right? We have homeowners insurance. I have to have because I buy with a mortgage, right? Whenever you buy a home with mortgage, you need to buy homeowners insurance. How often? What's the percentage? We claim for the home? It's 1 out of 1,200 houses. Only 1 out of 1,200 houses make claim, right, for the home insurance. What about cost? 1 out of 240 costs claim for accidents. But long-term care is 1 in 2 people who need long-term care. Some form of long-term care, not necessarily go to a nursing home. It could just simply need help, somebody take care of your house chores or buy grocery or do something for you. So here we draw the line with 4 people here. I draw the line, half people, don't need long-term care, the other half will need long-term care. So that's a huge percentage, 50-50. No, it's very high, yes. So you can see here, about 70% of Americans turning 65, they will need long-term care. 70% people over 65, right? That's a big percentage. So it's something that is a very big concern and high demand, for the community, for our family, really need to consider, what is the long-term care, how we take care of ourselves, if we cannot take care of ourselves, who gonna pay for someone to take care of ourselves, right? So this is something we need to plan, right? So you see, this is the wheels of life when we're little, right? When we're babies, our mother take care of us, right? Push us on a stroller, right? It's the love of a mother. It's free. It's free, right? It's the best wheel and it's free. So, and then we grow up riding bicycle, and I have our own cars, have family cars, when we retire, maybe buy an RV, to go on vacation, travel around, right? But then at the end of our life, who pushing us? The nurse, right? Someone will have to hire somebody to push us. That wheel is the most expensive wheel out of all this. Because you're paying somebody every day labor to take care of you. That's the most expensive way. So who pay for that? Right. So we we need to consider what is the cost of the long-term care and what are the services we can buy. Okay. You see here, home-based care, like homemaker service. We can hire someone to come to our home. At the early stage, maybe I still have my memory. I still be able to function, do things, work on my garden, or I can do something by myself. I don't need to check in a nursing home yet. So, but I need help, maybe clean my house, take care of my pet, help me to miss medication. So I want to live at my house. You can hire somebody to come to your home. Sometimes I think it starts from 4 hours and 6 hours and 8 hours. It depends on how much help we need, right? And the home health care. Number two, you can use a community-based care, meaning assisted living. You don't want to live at a house by ourselves anymore, or not capable. So I live. My mother-in-law used to live in an assisted living. It's like a community, 60 plus, you in the community, they have their dining hall, they have swimming pool, they have everything. You just live together there. And if you need help, somebody will help you. So, and then also you can go to adult daycare. When we're little baby, right, we send our kids to child daycare. When we get old, we need somebody to take care of, like it's my old parents, right? They cannot take care of themselves, and I have to work. So I can send my parents to adult daycare. It's just like kids, right? You drop them off in the morning and then you pick them up after work. And nowadays, actually, the adult daycare is much more flexible. They have, because you take care of elderly, senior citizens, right? So they have van, like a minivan, right? They will come and pick you up and then drop you off. That make it easy, for us, the caretakers at home. Right. Number three, that's a facility-based care. Nursing home, right? Nursing facilities. That's usually at the end of our life. Like, maybe I would say once people check in a nursing home, they will not check out, like average about 4 years. Some people might be 1 or 2 years, they're gone. Or some people last 10 years. I I have a coworker who's a lawyer. We worked together at IBM before. I worked for IBM for 5 years. So one of my coworker, her mother actually have Alzheimer for 10 years. But the early years, early years, my coworker cannot leave her mother alone at home. So she checked into the nursing home very early, right? But then she stayed there for 10 years. Yeah, but usually nursing home, because nowadays if you check in nursing home is really expensive. We're talking about this New England area, New York, Connecticut, Massachusetts. It's about $15,000 a month. So close to almost $200,000 a year. Who can afford that? So, and who can pay for that, right? For my IBM co-workers' mother's case was that they require her mother to sell all her assets, her house, her car, everything, sell everything. She have about $1 million something, and that money all go to the nursing home before they admit her. You say, I want all your assets. And then you send the money to them, they let you check in. And then when they exhaust, they use up all the money, right? You give them. After that, they will put you into a Medicare, a state government, right? Like Connecticut Husky, right? They will continue the government will pay because you use up all your asset, all your money already. So you consider to be low income. So when you're low income, you qualify for the state's help. So here's example. So 70% of people prefer home health care. Me too. If I'm at that stage, who doesn't want to stay at the comfort of your home? Yeah, you don't want to, check in a nursing home that was a bunch of other people. So, yeah. Now, this is the annual cost, but this is throughout the 50 states. Like I said, throughout 50 states, the average cost here is about 60,000. But we live in New England area, the most expensive area. It's about 200,000, between 150,000 to $200,000 a year. Yes. So, and also imagine the inflation too. I mean, now when we're 50 years old, right? Let's say I'm 50. I don't need long-term care now, right? Hopefully I don't need it unless there's an accident or something happened or stroke or anything. But if normally by aging, I might need long-term care in my 80s or 90s, right? So that's still I have 30 years to go. 30 years, you think will be the same price as today? No. With inflation, right? Crazy. Inflation is 3.2% a year. 3.2. So the money, the $100 last year, we go to the grocery store, buy groceries, right? Compared to now, you go to grocery stores. I feel like, what? I look at my car, it's like $100 buy these little things. The money doesn't worth that much anymore due to inflation. Yeah. So let's see here, that 20 years from 2022 to 42, that's 20 years. Inflation double. The cost double, right? So 20% of people live in assisted living. Only 10% check in the nursing home. That's like, there's no choice. They have no choice. You cannot really have somebody 24/7 take care of you. If even you have those home aid, I think the home aid, if you want 24/7, they need to have 2 or 3 shifts. Like each shift, they have like 6 hours to 8 hours. One person come to your house can only work like 6 hours, right? So you might need 3 shifts, 3 different people come to your house to take turns to take care of you. Yeah. So on average, a long-term care claim lasts about 4 years, right? 3.9 years. About 4 years, averaging is 4 years, right? So let's talk about the cost, right? We discussed the cost. So here is the New York area, last year, 2024. Like I mentioned, if you have to check in a nursing home private room, it's 15,000. Private just by yourself. What if I say I want to save some money, send my private, like I share a room with another person. 14,000 is not that much difference. It's less than $1,000 a month difference, right? Yeah, so for the homemaker, you want to stay at the comfort of your home. So you pay around almost $7,000 a month for people to take care of you. Let's look at Massachusetts, Boston area. Similar price, right? Homemaker service about 7,000. Adult daycare about 3,000. And then private nursing home, private room is 16,000. Let's look at the West Coast, Seattle, right? Washington State. Private room also 15,000. Homemaker about 8,000. Simple price. So when we reach, oh yeah, Seattle really expensive. The housing is very expensive too. I just went to Seattle in August for the Alaska cruise, and I look at the housing. It was crazy, really, really expensive there. Yeah. So it's about $16,000 a month. That's a month. So it's almost 200,000 a year. 4 years, how much? Close to $1 million. 800,000. So that's your house, right? Or 2 houses. In New York, it will be a house, right? New York house now at least like $1 million. Connecticut, maybe you can buy a small house for 300 to 800,000. So that's your house. So how do we pay for it, right? I want to talk about the type of benefit. If you do, some people, how do we pay for it? If you do a long-term care insurance, there's different type of payment. They pay for your cost, reimbursement. So reimbursement meaning, you check in the nursing home or you accumulate the cost, right? The service, and then they bill you, right? The nursing home bill you. And then either you pay it first out of pocket, and then you get the money from the insurance company, or you send a bill to the insurance company and they directly pay this facility. That's reimbursement. You have to have all your receipts together, meaning you have to be really organized. Do you think at that age, at that, state of your life, you need nursing, you need long-term care, you have that mentality or the ability to do reimbursement style? No, right? How can I keep all my receipts? I don't even know where they are, right? You will need another person to take care of this for you, right? So most people don't choose reimbursement anymore because it's just too difficult, for people who need long-term care. Indemnity and cash indemnity, that's a better way. When you choose a long-term care insurance, that they directly the insurance company will pay the money to the provider directly. It doesn't go through you. You don't have to, go through the hassle, right? And no bills or receipts to submit in order to collect the bills. Yeah. So there's no restriction on how the long-term care benefits you're going to use. What that means is, what if I don't want to hire somebody stranger, a doctor or nurse, a home aide to take care of me? I want my son or my niece or my friend next door, my neighbor. They're looking for job, for work, and I like them. I hang out with them. So, and they're capable of taking care of me. What happens if I want to hire them to take care of me? Yes, you can. So for the cash indemnity style, the insurance company will, when you need long-term care, you make a claim, they send you money like cash. When I say cash, meaning direct deposit or send you a check, right? And you can hire anybody in your family with healthcare license or without healthcare license. You can literally hire anybody to take care of you, and you just write them a check or pay them money. So that's a better way, to pay for your long-term care cost, right? So let's talk about Medicare. So many people ask me, does my Medicare, like when you're 65 years old, you have long-term care, right? Like you have the Medicare, right? So Medicare and Medicaid, you know what's the difference between those two?
Medicare is federal, Medicaid is state.
Right, right. So the federal Medicare, as long as you turn 65, everybody qualified for it. So the entire 65. 65. And you do have to pay, it's like a health insurance, right? It's a health insurance provided by the federal government. It's a health insurance, right? It provides for all the residents, the citizens, right, in the United States. And for the Medicare, you pay the premium based on your income. Based on your income, I think if you're low income, you don't pay. If you are, at the income threshold, I think some people pay. People I know, some people pay about $180 a month for Medicare. I also know some people pay $700 a month for Medicare. So it depends on your income level. Okay. But what about Medicaid? Medicaid is a state health insurance. is only for low income earners. So if I'm low income, my income threshold, is below the threshold, right? My income below this Medicaid threshold, I do not have to pay a penny. The state government pay for my health care, pay for my premium. But you have to be really low income to qualify, right? Some people ask me, does Medicare and Medicaid pay for my long-term care? That's very interesting, right? Very good question. Because I want to know, right? When I retire, if I need long-term care, anybody else pay for me? Does the government able to pay for my long-term care, or I have to pay out of pocket? Right. So let's look at Medicare, right? Medicare is the federal owned, right? Healthcare. So it's a federal health insurance program. So in terms of long-term care, they will pay the first the first day to 20 days. Within, when you need a long-term care, the first 20 days, they pay 100% of your cost. Assuming that you have to be sent in the hospital, the emergency room, for them to count, you really need a long-term care in this scenario. You have to check in the ER first. They have a record, right? You have an emergency, you have a health condition, you will send to the ER, and the doctor diagnose you need long-term care, they will pay the first 20 days, they pay 100% of your cost. But starting the 21 day to the 100 day, you pay $209.50 per day. And the Medicare pays any balance. So the 100% only within the first 20 days. Okay. And then after 100 days, no cover. You're on your own. Right. So imagine, if a nursing home costs you, like, say, $300 a month, right? They charge you $300 a month. You have to pay $209. The rest, the state, the Medicare pay for it. But after 100 days, you pay 100%. Let's see, Medicaid. So like I said, Medicaid is a state public assistance program for low income earners. Yeah, you have to see if you qualify with the low income, monthly income, and then limited assets. When they say limited asset, usually meaning you cannot own more than $3,000. Meaning your car, your house, right, jewelry, or any belongings, no more than $3,000 worth of assets. Otherwise, you're not qualified. Yeah. Okay, so then who is paying for my long-term care if I need it? Children, family? Susan, do you have children? No. Okay. Hmm? Oh, okay. So but how about family? Do you have
Brother.
Okay. So you take care of each other? No. Okay. I have a son. My son's over there behind you. His name is Nicky. Yeah, he just graduated from college in May. So yeah, so he's doing the library event with me. So thank you, Nikki, for being here. So for long-term care, if I don't have money, I'm not prepared, right? I cannot pay. I can ask my children, right? But he have to willing to take care of me, right? I ask doesn't mean he will do it, right? What if he is married and have kids? What if his wife doesn't like me? Right? I don't want to create a problem for him and his family, right? So if you have family take care of you, it will create an emotional and financial burden for them. I don't want to burden my son. He have his own life, his family, his job. Am I expecting him to quit his job and take care of me 27? That's not what I want. I want every time he come to me, it's like, I dress well, I have dinner, have lunch with him, have a good time with him. I don't want him to see me or wipe my butt or clean my body or feeding me, something like that. So yeah, even you have family, I don't count on the family because it's very tiring. Take care of someone 24/7. Maybe they're nice. Maybe my son says, "Oh, mom, I'll take care of you." How long? A month, 2 months, 6 months, a year? At the most, probably a year later, say, "Mom, I'm really tired." So what about savings, retirement assets? Like people say, well, I have 401k, right? I have saving money in my CDs in the bank. I have stock market, I have money in the stock market, right? I can pay. But have you think about, did you save enough? Is it all your assets together you save enough, right? And also, if you need long-term care before 59 and a half, for you to get money from your 401k account or your pre-tax account, like traditional IRA, you have to be over 59 and a half. If you're younger than 59 and a half, you take money out from your retirement account, there's a penalty, 10%. What if I need long-term care when I'm 50 or 55? And I'm forced to take out money from my retirement account. I have to pay 10% penalty because of my age, right? I'm younger than 59 and a half, and also have to pay tax. All the retirement account, right? Except Roth account, I don't pay tax. The rest of the accounts, I have to pay tax. So even the stock market, if I have a brokerage account, even I have like $1 million stock, right? If I sell the stock, do I have to pay tax first? Yes, you do. You have to pay capital gain first. After you share the money with Uncle Sam, whatever net gain you used to pay for the nursing home, to pay for somebody to take care of you, right? How about easy liquidated? Some people say, I have many houses. I'm a landlord, right? I own many houses. When I need long-term care, I'll sell my house. I'll sell my rental property. I will sell my home to pay for my long-term care. When you need the money, can you really sell your house that quick? In a month, in a few days? Sometimes it could take months or a year or a couple of years you couldn't sell your house. It depends on the situation, right? Like during the recession, nobody had money to buy a house, right? People set their budget, so at that time, if you need long-term care, you cannot sell your house. What can you do? So when we're thinking about use our asset to pay for our long-term care, we really have to think through this, right? Is safe enough? Do I have to pay penalty if I take out money early? The liquidation, right? Liquidation. Can I liquidate? Can I cash out this asset quick enough? Right. How about government, right? Just now we talk about government help, the Medicare and the Medicaid. Of course, we all want free money, right? We want free from the government. But not everybody qualify for it, right? They have limitation on actually, if we check into a state-owned facility, nursing home, the quality of the service, it is significantly not as good as the private. You get what you pay for. You didn't pay anything for the state-owned facility. You get that kind of service. If I pay for expensive, a 5-star hotel, like kind of, facility, I will enjoy my life, hopefully, right? Enjoy my life there, right? So it's a limitation on the care and then by your income, right? If your income is too high, you're not qualified. So the other way we can consider is insurance. It's long-term care insurance. The insurance can leverage, right? Usually why we buy insurance for this? Why we buy insurance? Because there's a leverage to take our risk, right? We have the risk that someday we'll need long-term care. We need somebody to take care of us. And the risk is I need the care, but I don't have money to pay for it. How do I leverage this insurance? I pay a small premium on a monthly or annual basis, and I get a big benefit. Let's say at my age, you're 40 years old, I probably pay total 100,000 total in the next 10 years or 20 years. And that doesn't mean I have to put 100,000 all at once. I put it on a monthly payment. And in exchange, I probably getting about $500,000 to $800,000. The benefit for the long-term care. So is it worth it? So you leverage the insurance rather than liquidate your assets. Because this, you liquidate your asset, you have to pay tax on. Here, you have tax deduction when you pay for your premium, and it's tax-free when you use the benefit. You don't pay tax on benefits, right? So we have tax-free benefit, and we can also protect your asset, right? Like I said, my coworker from IBM, her mother sold everything and give it to the nursing home so she can check into the nursing home, right? Take care of herself. But what that means is that she have no money to give to the next generations. You cannot pass down, your asset to your legacy to the next generations. Yeah. So this way, the insurance can protect your assets. How to prepare for the long-term care, right? We talk about if you prepare with you heard about traditional long-term care insurance? Have you ever think about? Or ask other people tell you, say, I often hear, Katrina, the long-term care insurance is too expensive. I cannot afford it. When they say that usually mean it's the traditional long-term care. I have clients for the traditional long-term care, maybe 30 years ago, when they're young, right? When they're 40s, in their 40s, they paying $2,000, $3,000 a year. But then when they turn like in the 70s now, they're probably going to need long-term care anytime soon, right? However, the traditional long-term care, they increase the premium every 5 years. From the original $2,000 a year, now it's over $10,000. When they probably need the care the most, they cannot afford it anymore. So they can have to drop it. It's just like the car insurance, right? Car insurance is like when you have a car accident, you use it, right? You make a claim, insurance claim. But insurance pay for the mechanic to take care of your car, right? To fix your car. But if you never use it, you never have a car accident. You just pay every month, the monthly premium. You never get to see the money or use it. Traditional long-term care, the same thing. If I never need long-term care, if I just, force in my sleep, I just see, go to heaven, see God in my sleep. I don't need long-term care. I don't need anybody to take care of me, right? If I'm that lucky, who knows? Not many people that lucky, right? Pass away in your sleep. That's the most lucky thing. Yeah. But then, this way, the traditional way, if you don't use it, you don't need long-term care, the money, it's just like car insurance. You don't make a car accident claim, the premium's gone. You can never get it back, right? Same thing here. That's why this kind of traditional long-term care is getting like shrinking. Nobody actually buying it. The demand is very low. They're not even selling it anymore because it's too costly. Yeah.
I know some people that years ago,
Mhm.
they put it out with bandits,
Mhm.
but it was different back then. And the companies, sorry, because they didn't know they were gonna lose it.
Mhm. Yeah.
Companies losing money on it.
Exactly. That's the issue. Because in the old days, people don't live that long.
Right.
People live till like their 70s. Now people live their 80s and 90s. So, they bankrupt the insurance company
Yeah.
because people live too long, right? So now insurance company figure out another way to help people to have long-term care coverage, but not like use it or waste it. If you buy this insurance, a new kind, the money gonna stay with you or within your family. You're not gonna lose it if you don't need long-term care. So this is a better way to plan your long-term care needs. So what that means is, this is called 7702. It's a tax code. It's a IRC, Internal Revenue Code from IRS. 7702 is have some tax benefits. If you Google IRC 7702, yeah, it's a tax benefit code, just like your 401k, right? You have tax benefits. And IUL stand for Index Universal Life. It's a kind of life insurance, for us, right? Insure on us, on people. And you can, on your normal regular life insurance, IUL 7702 IUL, you can add a long-term care rider. Say, for example, I'm 40 years old. I purchased a $1 million life insurance, 7702 IUL. Okay, I have 1 million. So my death benefit is 1 million. If I die, my son going to have that 1 million, right? Tax free. But I add a long-term care rider to this policy, meaning every year I pay maybe the cost is about 500, a few $100 a year per year. So it's about like it maybe $30 a month, right? That way, if I add a long-term care rider, I have early access to my death benefit. Death benefit you mean when I die, right? After I pass away, the money go to the beneficiary, go to my family, go to other people, not me. I can never see the money. The money come when after I die, right? But if I have early access to my death benefit, meaning when I'm still living, I'm still alive, but I need long-term care. I need somebody to take care of me. I can take that 1 million for me. I can use that 1 million to hire people to take care of me when I'm alive. So in this way, 3 birds killed by 1 stone, right? So 1 stone, you kill 3 birds. Either if I pass away, death benefit, tax-free death benefit for my loved one. If you're doing a legacy planning, right? If you leave money to your children with like a house or a stock, a brokerage account or 401k, if you leave money to your next generations, they have to pay tax before it go to them. But here, death benefit from a life insurance is tax-free. You don't pay tax on that. And then cash value. This kind of 7702 is a permanent life insurance with cash value, meaning you can treat it as a saving account. You invest money, you put money in the life insurance account, you grow your cash value. Just like you open a brokerage account, you can, invest in there, you can do mutual fund, you can do S&P 500 indexes, you can do like a fixed interest. So there's so many kinds of way to build your cash value here. This cash value also offer you living benefits. So I'm still alive. I can use the cash in this account for myself. I can use it for my retirement. So myself, I about 10 years ago, I opened account like this, and I start putting money. Like at that time, I'm working for IBM. So IBM give me 401k match, right? Do you work for company give you a match?
I got.
Oh wow,
They
100.
said they never did that. They don't do it too often.
I never heard. You're
Yeah.
so lucky.
Yeah, a lot of their valuable.
Wow, you're really a key person in the most important person in this company. I never heard 100% matching. It's a lot. The normal is 3%, 4%, or high is 5%. Big companies like IBM, like Apple, they offer 5%. 5% of my income. Let's say I make 100,000. 5% is $5,000. If I put $5,000 in the 401k, IBM match 5,000. So total, I have 10,000 that year put into my 401k. That's called match, right? So at that time, 10 years ago, when I was still working for IBM, I did the match. At the first, I maximize my funding. At that time, I believe it was like about 15 or 17,000 annual you can put in the 401k maximum. So I maximize that. But then when I found out this account, I actually just contribute 6% to IBM, just make sure I get that 5% match. And then the rest of money I put into the 7702 IUL because the money I grow here is tax-free. The money I grow in my IBM 401k account, it's all taxable. When you take out money from your 401k, do you know you have to pay tax on the 100%? Every penny you take out is taxable. Yeah. I have another client from Long Island. Her husband is a pharmacist at the hospital in Long Island. And she worked as a teacher assistant at a local, public school. So they have two sons. So at that time, 2 years ago, one son is in a bachelor degree, right? It's in a college. Another son pursuing medical school. So a lot of expense for this last couple of years for them because the kid go to college. At the same time, her husband, the pharmacist, he didn't take care of his own health. He's like he have kidney problem. Like he didn't do good diet, exercise, or anything. He just abused his body. So what happened was like he have a kidney problem. He have to, do procedure and a lot of things. So he was forced to retire at age 62. He didn't. He was thinking retire at age 67, right, or 70, but he was forced because his body, he cannot work anymore. So what happened? He retired, and he had to take out money from 401k because their two sons go to college and medical school. The tuition is really high.
Oh.
So every year they have to take out $200,000-$300,000 from the 401k. And they were shocking how much tax they have to pay.
Yeah.
They didn't know after we retire, we have to pay tax. Believe me, a lot of people not aware. I'm not surprised. Yeah. So here, if I save my money here in a 7702 cash value, I build the cash here. I supplement my 401k retirement account. So when I retire today, I need money, I take some money out from my 401k, I pay the tax. Be a good citizen, pay my tax. The other side, I take money from the 7702, I don't pay tax, which will lower my tax bracket. Imagine if today I retire, I need $100,000 for my household. I pay for my property tax, my car, my monthly expenses, I need $100,000. If I take $100,000 from my 401k, how much tax I have? About 22%. Federal plus state. Let's say altogether about 30% I have to pay tax on that 100,000 for a single person. But if I take out only 20,000 from my 401k and 80,000 from the 7702 account, what's my taxable income?
Yeah.
20,000. Because out of the 100,000 I need, right? 20,000 from my 401k, 80,000 from my 770, my insurance account. The 80,000 I don't pay tax, but the 20,000 from my 401k I do have to pay tax. But my tax bracket is low. I only need to pay 10% rather than 30%. So it's still good, right? Yeah. So this is another way the cash value can fund your retirement. And then also you can use it for your long-term care. If I need long-term care, they actually give you 2% of your face amount. Let's say I purchase a $1 million IUL coverage. If I need long-term care today, they will pay me 2% of the 1 million, which is 20,000 per month. Per month. So a year, that's what, 240,000. I can take out from this account. And I don't pay tax. It's tax-free. Yeah. So this is another way people plan for their long-term care needs, because you don't know when you need it. And you don't know if you ever need it. Right? In that scenario, this is a better way, because there's 3 ways you can use this money. You use it for yourself, for retirement, or for your long-term care needs, or you don't need all those. You just give to your loved one. They stay in your family. Right? And there's another one. This is linked benefit long-term care. This kind is like, it more focused on long-term care, not much on the death benefit. Let's say if today I have $100,000 in my bank and I want to use it for my long-term care. So I put the $100,000, I purchase maybe a $500,000 long-term care benefit. When I need it, I have $500,000 for my long-term care. So you use $1, you buy $5 here. Right? It's a leverage. You only pay $1, now you get $5 benefits. What if I don't need a long-term care? What happened to me? Yeah, they will return your premium to your loved one or to you. If I don't need it, if I cancel it, just return my premium. Sometimes it depends on your age. If you are younger than 60 years old, they will return your premium plus 1 to 2% interest. If you're over 60 years old, they probably just return your premium. So this way, this is still good, because your dollar, you buy more long-term care benefits. $1, you pay $5. You use $1, pay for the $5 benefits. If you don't need it, you just get your premium back, your money back. Yeah. So it depends on situation. Yeah. Some people, like if you have a spouse, you have a husband, or you have a kid, right? Within, I believe, 24 years old. Like I'm 23 years older than my son. So within the 24 years apart, me and my son can be in the same long-term care policy. And you and your niece too. Like, you and your family member within the age 24 years difference, you can be in the same policy. Because I don't know if I will need it or he will need it. So 2 people in the same policy, we can share the policy, share the benefits. Yeah. So here's what we talk about, 3 birds with 1 stone, right? This is the one on the all the way on your right. So the 7702 IUL. Let's say I'm 54 years old and I purchase the benefit is $500,000. Okay, long-term care benefit, $500,000. So totally, I'm 55, right? Total, I pay $138,000 total in 10 years. So every year I pay $13,884 per year. So each month is about a little over $1,000 for 10 years. So this 138,000, I can buy $500,000, $500,000 long-term care, all death benefits. So you see, long-term care is still very good deal. 138,000, you buy 500,000 benefits. Okay. So if you pass away, the death benefit go to your beneficiary. Okay. And then or you use it, for your long-term care. And here, you see accumulative value, That's your cash value. You can use this money. Let's say when you're 60, like when you're 69 years old, your money grow to $152,000. That's your money. If you need money, you can take out money from here. So in this plan, you can use this money for your retirement, right? For your cash needs, or you can use this for your long-term care needs or for death benefit. It's the same pool. It's a $500,000 pool. You use for yourself for retirement, for cash needs, or use it for your long-term care needs, or leave a legacy to your family. Okay. So this is one of the example. I'll talk about the third one, the long-term care. This is called Nationwide, Your Life Care Matters in Action. So what happened is we put $100,000 premium here, one-time premium here, single premium, right? You buy 5,000, 15,000, $481 long-term care benefit. Yeah. Yeah. So the first 2 years, it's accelerate your death benefit. It's just add together, totally you have 6 years benefit. They pay you this $500,000 within 6 years. Averaging every month, you have the same payments. Yeah. So then, and then also, when you use up all that long-term care, you use all this, right? The $500,000, you use it all. When you pass away, they give you this, that's benefit, 17,000, which is 10% of this for your final expenses. Still very nice for funeral.
Yeah, that's fun.
Yeah, yeah. So it's, I think I like this plan too. My client like this plan. Yeah, because 100,000, you buy $500,000. And then you have a final expense coverage. Yeah. So this is an example. We have Michael here, right? Michael, one person, 60 years old. Michael has a CD. He has renewed that CD several times, right? He doesn't need the money for the retirement income. So he has earmarked it for unexpected. He saved it for unexpected costs, right? Such as a possibility of long-term care expenses. So his worry is that the CD might not grow at the rate that he needs to help to pay for his long-term care. What is the CD rate now? 4%? You buy CD? Oh, no? Okay, so what do you buy? Like stock or housing? You don't invest your money? Oh, okay. Maybe that's something you need to think about. Because like with inflation, we talk about inflation is 3.2%. If your money don't grow more than 3.2, you're actually losing money because your money shrink, right? The cost of living is getting higher. If you're still having the same money, the cost is higher, you're not able to pay for those costs. Yeah, so we need to grow our money, right? So here, CD definitely not a very good way to grow your money. It just barely beat the inflation. It's not really helping you grow your money. So in Michael's situation, he put his $75,000. He purchased this long-term care product. He used $75,000 by $310,000 benefit, long-term care benefits. Okay, so this $310,000 total benefit gives him $4,315 per month long-term care benefit. So when he needs long-term care every month, the insurance company will pay $4,315 to him to pay for his long-term care needs. And he can use that for 6 years. So if he doesn't need This long-term care, they just return the premium back to him. Yeah. And if he pass away, death benefit is a little more than what he put in. Like I said, he only put in 75,000. But if he died, the death benefit give it to his loved one is 103,000. So there's about $30,000 interest go on from his principal. So this one is Robert and Lisa. Robert and Lisa, they take care of your Lisa's mom, right? Lisa's mom needs the long-term care. So they know how hard it is, to take care of a loved one without insurance, without anybody's help. So they were thinking about for themselves. They need long-term care sometime in their life they need it. So they did some planning because they have a family history, right? His mother-in-law, Lisa's mother, need long-term care. They went through the process. So now they plan for themselves. So Robert, 55 years old, and Lisa is 50 years old. Robert invests $50 to buy a $236,000 long-term care benefit. And Lisa buy a little more, she invests 75,000 and buy a $4,000 long-term care. So this way, when they need long-term care, Robert will have 3,000 a month. Lisa will have $4,500 a month to pay for their long-term care, to pay for somebody, the home aide, homemaker to take care of them, or even go to nursing home. Nursing home is 15,000 a month, but here at least something to cover. Not, sometimes maybe we cannot do 100%, but we just do as much as we can. Sometimes, like if we have a house, we cannot liquidate, cannot sell our house to pay for the long-term care right away. It may take some time to liquidate your asset. But if you have this insurance, you can use the insurance money first. So give you time to liquidate other assets to pay for your long-term care. So have you ever heard about the long-term care payroll tax? You work for a company, right? You receive W-2 income or 1099?
I don't do my own.
Oh, okay. So what happens if you are employee, right? You work for someone, you work for a company. They take out payroll tax from your gross pay every month. So after your company pay tax to Uncle Sam, whatever left over, the net pay go to you. So the money you see every month, it already after you pay the tax. You never see those money because they go to Uncle Sam. So what happened is now because the high demand for the long-term care, so the government also worry about the long-term care because if we don't prepare for long-term care, government have to take care of us.
Right.
So what they want to make sure we prepare. So what happened is they inactive, like this is state by state. This is, we talk about in the West Coast, like Washington state. They began to collect the long-term care payroll tax starting July 1st, 2023. They force everyone, if you work for a company, from your paycheck, they take a percentage from your paycheck and send it to the state of Washington for your long-term care, for your future long-term care.
That's the only state.
That's the only state that enacted the law. The next few states is Massachusetts, New York, and California. Those are 3 states. And Connecticut probably will be the next. So eventually, all 50 states, they will have this. Because they have, usually that's what happens, state laws. One state started it, and other states follow. So yeah, this one, you can waive to pay this tax. Before they enacted this law, if you have already purchased private long-term care insurance, when this comes, you just prove to them, I have a proof, I already have a coverage. I don't need your state coverage. They can waive for you. You don't pay this tax. I did that for my son. because thinking he's so young, he's 21. So if he work in the future, he's going to pay this payroll tax, long-term care payroll tax for the rest of his life. But if before they enacted this law in Connecticut, he already have long-term care insurance. He can waive that for life. What happened? This long-term care payroll tax is really unfair for people. So let's say I am a high income earner, like Lisa is a low income earner. Let's say, for example, let's say I'm making $1 million a year. And I have to contribute 1% of the long-term care payroll, 1% of $1 million. How much is that? 10,000? Yeah. It's 100,000 or 10,000? 100. It's 1% of $1 million. I have to put 10, right? 10,000. But if Lisa making, let's say, 50,000, 1% of the 50,000 is what she's contributing. You see the difference? The percentage is the same, but it times multiply my income. I pay more than her. When I need a long-term care, our benefits the same. I pay more throughout all my life for this long-term care, the government owned. But when I need the care, we have the same benefits. So it's not fair for high income earners. This program. Yes. Yes. Yeah. But that's why there's the other you can do. You can purchase the insurance and then you can waive that. Yeah. So what do we care about, when we choosing a long-term care solutions, right? We said was a few ways for how to pay for long-term care, right? Family take care of us, throw out the door. Or government take care of us. No, I have a house. I don't think they will take care of, throw that out of the door. What about my 401k, my house pay for me? I have to pay tax on it. Probably not enough, So yeah, if we the best, the most efficient way is to buy long-term care insurance. And you have to choose which kind. There's different kind. You have to choose which kind is the best for you. So when you choose a long-term care solution, there's a few things I want to point out you need to pay attention. Number one, is it a cash indemnity style? Remember, we talked about reimbursement style versus cash indemnity. Reimbursement meaning you have to collect all the receipts. You pay for it first, or you have to reimburse, right? Get reimbursed. But cash indemnity is like, if I buy $1 million coverage, 2% of $1 million is 20,000 a month. Every month, they send me a check or direct deposit to my bank account. I don't need to do anything. So make sure you choose the cash indemnity style. Okay. And then choose 100% informal care allowed. Some policies only allow formal care, meaning you have to hire a registered nurse, a licensed doctor, a licensed home aide. Somebody is licensed, healthcare licensed person to take care of it, meaning your family member cannot take care of it. Look out for those policies that informal care. This person can be my neighbor, my best friend, my son, who have no license. Informal can take care of me. That's more flexible, right? And then international benefit allowed. I'm originally from China. I'm from Shenzhen, China. You heard about Hong Kong?
Yeah.
Hong Kong, right? So I don't know. I might go back to Hong Kong when I retire. I don't know. Right now, I'm happy here. But for immigrants, right? They might go back to their own country. What if I buy a long-term care insurance here? Do I stuck here? I have to use that here. Some policy they do. Some long-term care insurance only allow you to use it domestically in the US. But there's some allow you to use internationally. So let's say when you retire, you want to move to Spain or move to Europe, move to Asian, or move to China, or cheaper somewhere, or maybe just go to Brazil, right? sunshine and cheap, right? You can go internationally and you can find a facility in that country and they still pay from the US dollar. So that you want to choose a more flexible international use, meaning you can retire anywhere you want in the world. You don't want to stuck just in the US, right? And choose, you can choose, like I said, 2%, 3%, or 4%, monthly benefit limits. I personally, you choose the 2%, yeah, because it's cheaper. The 4% is a higher cost. And if you have a loved one, a spouse, or a domestic partner, there's a discount. Oops. So Lisa mentioned 90 days, right? Remember we said the Medicare pay for the first 100 days? And then after, because they have to be long enough to call long-term, you have to wait 90 days. So after 90 days, you kick in this policy, it will pay for your long-term care. So this is when you choose a long-term care, what's to look out for. So this is my information. I have an office in Danbury. It's reached like 10 minutes from here. And I have an office in Flushing, New York, and Queens. So for today, whoever attend the library event, I will give a free one-on-one consultation for an hour. So anything you want to discuss about your long-term care, about your retirement, about how to save tax, I'm a CPA, so I can talk about, tax matters too. So anything, I give a free one-on-one consultation.